Hi, I'm Nathan Young, board certified sports physical therapist with Yada Yada. Today I'm going to talk about biceps tendinopathy. If you just recently injured your bicep muscle, it would be more of a biceps tendonitis, and see my video on acute elbow pain. If you injured your elbow and the muscle, or you get a ball in there, you might have ruptured the muscle. If that's the case, we ask you to immediately seek medical help. What I'm going to talk about today with biceps tendinopathy is my top 4 home treatments for biceps tendinopathy. And we can have 2 types of it, and we'll talk a little bit about both. We can have a distal biceps tendinopathy that attaches down in this area, or you can have it up in your shoulder as the biceps comes through the groove. And these exercises and stretching can be done for both. So the first thing I'm going to talk about is stretching. So a lot of times when we're tied in there, we might not be able to straighten your elbow out, and so you can just kind of push down and straighten it. You can even rest your arm on something with a weight and let it bring down here until you stretch out that bicep. And you want to hold that. So as you're stretching that out, hold that for 30 seconds. You want to do that 3 times, twice a day. The second thing you want to do is some massage. And we want to talk about a specific massage, a deep tissue massage. In the clinic, we often refer to this as ASTM or ASTM, and we have special tools. But you can use tools that you can find right in your kitchen. I'm going to use a butter knife and actually hold the back end of that so we can get in that area and do some massage. The other thing we use is some massage cream. You can use massage lotion. I like massage cream better because it'll last and not absorb into your skin. And so if it's a distal biceps tendinopathy, you can put it right down in this area and apply it up your bicep area. If it was higher up, you could put the cream there and work at the same thing, the same technique, just higher up. I'm going to take that back of that butter knife and kind of right where it gets tender in that distal bicep and start working that up. And so I want to get in some deep tissue massage and bring it up until you start to feel it working. You might feel a little bit of crunching or grinding in there, and it's kind of breaking up some of the tissue or adhesions in there, and that's perfectly fine. I've had patients say it feels like I have gristle in there and it's breaking up, and that's perfectly fine. When you get done, there should be redness in that area. I usually like patients to do that for about 5 minutes. That massage is bringing blood flow to the area to help that tendinopathy remodel. The next thing I want to talk about is ice massage. And so you can take a paper cup or styrofoam cup that you've frozen in the freezer. You can tear off the outside, which I've already done, and then you just want to massage the area. So if it's a proximal bicep, you can do it right up here where it comes through the bicipital groove. I'm going to do it down here lower in the distal biceps or the cubital fossa in there. And so you want to just kind of go in circular motions and start going around. When I do ice massage, I like to go about 5 minutes. Oftentimes I'll have patients say it starts to ache or burn and then throb, and then the last minute or 2 it'll kind of go numb, and that's kind of the effect that you want to do. And you can do this 1 or 2 times a day. The last thing I want to talk about is eccentric strengthening. And so when we talk about different types of strengthening, we have concentric, which is shortening the muscle. So for my bicep that attaches in here, as I bring it up, I'm going to shorten that muscle, and that would be concentric. Eccentrically is bringing it down, and so with the weight, it's lengthening it. And so those tendinopathy, that eccentric with research has shown to help remodel that tendon over a few weeks to a couple months of strengthening. And so I'm going to take this weight here, and you can bring it up really quick, and then you want to slowly lower that down over 5 seconds, and then you can bring it back up. Should be difficult with it and really feel it working that muscle, so slowly lower that down, bring it back up. A lot of times I like to count as you lower it down, 2, 3, 4, 5, and bring it back up. And again, lower it down. 2, 3, 4, 5. And you can oftentimes even use your other hand if it's too difficult to bring it back up. And then lower it down. 2, 3, 4, 5. So with the eccentric strengthening, we want to do 2 sets of 10, slowly going down over 5 seconds, twice a day. So those are my top 4 treatments for biceps tendinopathy. Hopefully this has been helpful. If you have increased pain or you're not getting better, see your healthcare provider or specifically your physical therapist. Thanks and have a great day.